Good afternoon, everyone, and thank you again for joining us for the Differential Adjustment DAP for Social Determinants of Health SDOH program. We are muting all lines today, so we encourage you to use the chat feature throughout today's presentation. Christy Dye, our Chief Business and Development Officer, will begin today's presentation. Christy, I will turn it over to you.
Thank you very much, Christine, and good afternoon, everyone in the audience. Welcome to this final Health Current webinar on the 2022 Differential Adjusted Payment Program, or DAP for short, focused on social determinants of health connectivity. As Christine told you, my name is Christy Dye, and I am the Chief Business Development Officer for Health Current. I'm joined today by my colleague, Andrew Tarek. He's our Program Director for Social Determinants of Health. We're really excited to bring information to you about this new DAP program, which pays eligible providers a 1% increase on their Medicaid claims for registering to get connected with our SDOH platform. Today, we'll be covering some background on the Access DAP program. Andrew will then walk you through the features of our new SDOH closed-loop referral system, and then we'll review eligible provider types, milestones, and requirements of the program, and how to register. I plan to leave about 15 minutes at the end to answer questions, so feel free to enter your questions as we go, put them in the chat. Health Current will also post an update to our frequently asked questions document on our website at the end of the session. So let's go ahead and get started. Just a little bit of background about the DAP program. In partnership with Access, Health Current has been a key component of the Differential Adjusted Payment Program all the way back to its inception around 2016, 2017. We're really happy to announce today that eligibility for the regular Differential Adjusted Payment Program has been expanded in a very special way in order to encourage participation from healthcare providers in Health Current's new Social Determinants of Health referral system. Next slide, please, Andrew. So DAP itself is part of Access's strategic initiative around value-based payment and enhancing value for patients who receive care in our system, providers who deliver care and patients who receive care in our system. So every year there is an annual DAP program, and it attempts to distinguish providers that have gone the extra mile. So they've done something special, met a certain milestone that results in improving member care outcomes or the experience of members that they have with our care, reducing cost of care growth, and most importantly for us as Arizona's HIE, getting connected to using and accessing and sending data exchange with the Health Information Exchange under Health Current. DAP does include a variety of other milestones and program requirements that have nothing to do with the HIE, which if you read the notice, you can go through all the details around those other requirements. Today's DAP webinar really focuses on healthcare providers and other Access registered organizations getting connected to Health Current's Social Determinants of Health referral system. Next slide, please. So the basis, one of the fundamental pieces of the DAP program for milestones achieved during that annual DAP year, Access actually pays providers incentives in order, based on their meeting and exceeding certain milestones. For us, the big ones are related to HIE requirements. And as I said, those have been a component of the DAP program since it was first conceived. DAP is scheduled always on an annual basis. So it's a contract year-end schedule. For most of us, this means the same thing as federal fiscal year. So the dates of service that are relevant for these DAP incentives will be services delivered between October 1 of 2020 to September 30 of 2022, excuse me. Next slide, please. If you wanted to read all of the program detail, the policies by provider type related to this particular DAP initiative, you'll find that final public notice posted on the Access website. It was updated actually more recently than April 5th but you'll be able to find that notice at this link, as well as more information about the HIE requirements of DAP in general and the social determinants of health special DAP program. On the Health Current website, we will be posting this webinar deck, and I believe Christine will also send it out. So these links will be live and active for you. Next slide, please. So who's eligible to participate in this special DAP program? There are a variety of provider types that really weren't much involved with the differential adjusted payment program in years past, for whom eligibility has been opened up for that 1% DAP incentive. Behavioral health outpatient clinics, provider type 77, integrated clinics, provider type IC, physicians, physician assistants, and registered nurse practitioners. Those are provider types 08, 18, 19, and 31. Community service agencies, provider type A3. Licensed independent substance abuse counselors, provider type A4. Behavioral health therapeutic homes, provider type A5. And rural substance abuse transitional agencies, provider type A6. And it's very important to know the provider type under which you are, because that is how you will register for the DAP program and how your incentives will be processed. The due date for the registration forms, and we'll share the forms a little bit later in this presentation, is May 14. So it's this week. We're on the last couple days to be able to get your registration form and list of eligible providers into Health Current. You can find the registration form available to download on the Health Current website at this address down here at the bottom. Next slide, please. I'm now going to turn it over to Andrew to walk us through the Health Current Social Determinants of Health closed loop referral system.
Thank you, Christy. All right, so first, just want to highlight the partnerships, as Christy already noted. Health Current is teamed up with Access, but another partner in this project is 211 Arizona, which is operated by actually Solari, their formerly Crisis Response Network. And NowPow is the vendor that we chose for the system. And we've come together to build a statewide social determinants of health referral system for Arizona. And thank you all for attending today. So in addition to those partnerships, we've also worked with 30 different organizations as part of our social determinants of health work group. And it's this group that really helped us decide what types of features we were looking for in the referral system that we ended up choosing. And we really want to emphasize that this will be a statewide solution for all Arizonans. So although today's session is very much focused on the DAP program and access, just so you know, for other organizations out in the community, they do not need to be enrolled with Access to use the system, and members do not need to be enrolled in Access in order to benefit from the system. So this is for anyone who wants to use it, whether they're on Access or not. So we're going to talk a little bit about the genesis of the program. So the genesis of this system really is with Access's Whole Person Care Initiative, which they officially launched in November of 2019. And the Whole Person Care Initiative was Access saying that we really need to focus on the critical importance of addressing social risk factors as a key part of that continuum of a person's health and well-being. So Access connected with community stakeholders and identified 3 key areas of need. One was transitional housing, particularly individuals leaving correctional facilities, those being discharged from behavioral health inpatient stays, and individuals experiencing chronic homelessness. Another area of focus was non-medical transportation, specifically looking at helping people get access to healthy food and employment navigation services. And lastly was social isolation, and this can impact individuals who receive long-term care services in their homes, including but not limited to peer support groups. So what are the social determinants of health? A lot of you are probably very familiar with this definition, but research supports that if we address social determinants of health, we will have better health outcomes. Even if that means something as simple as setting up an appointment for someone and ensuring they have transportation and childcare so that they can attend that appointment, or addressing more life-threatening needs like a safe place to sleep at night or where someone's going to get food for the day. When we solve for these factors that impact people's social environments, we give people a greater opportunity to succeed because they're able to free up more time to address their healthcare needs and live fuller and healthier lives. So what's our purpose? Three main areas. First, we want to build a bridge to connect healthcare providers and community-based organizations. In order to address the social determinants of health needs of our community, we need to create more accessibility to services and streamline communications so that a person can get the help they need when they need it. So really building that connection between our healthcare services and our social support services. And then second, with a greater focus on the social determinants of health, we can make it easier for Arizonans to obtain that essential social economic service, thus improving their health, well-being, and quality of life. And this really makes it that whole person care approach with that additional focus on social determinants of health. And this partnership will foster the rollout of a statewide technology solution that will facilitate the capturing of screening data and codes that relate to social risk factors, creating a data-driven approach and seamlessly refer members to community resources. So having that data will really help inform us as a community of how this is working, where we have areas of need, and what we need to do to address those areas of need. So let's go through some of the features, just a brief overview. So first is the referral directory. So as an organization, if you're adopting the system, you can identify a group of organizations that you're currently working with and build your own directory of referrals. So if you have a close relationship with an organization currently and you make a lot of referrals with them, you can identify them as a closed loop partner and start to provide referrals and get that referral feedback. But it'll be your decision on who you want to create those closed loop relationships with. In addition to that, if you just want to use the system to search for additional services, or you're looking for services outside of your closed loop network, we'll be loading, in our partnership with 211 Arizona, we'll be loading their Health and Human Services directory, which has over 35,000 services. So you'll be able to access all those services for shared referrals, which is essentially just providing an individual the referral information. So if a person comes in, you're providing them with the referral information of where they can go. And you'll be able to track that information through the system. So it really creates a lot more data around the referrals we're making, and you'll be able to see who you're referring to and who is referring services to your organization. And the system really fosters a no wrong door approach, which means that anyone who's using the system, you can register a person at that location. So when you think of this no wrong door approach, it's really looking at this from a community effort, coming together to decide that a person in need comes before anything else. So we're not directing people to one place or types of places to get the help they need. Rather, we're coming together as a community with a commitment to help that person get directly connected to the services, no matter where they show up. So the system also has screening tools built in there into the system. So you can do social determinants of health screenings on the referral platform. And the one we highlight here is to prepare. That's going to be the default screening tool in the system. However, there are several other options of evidence-based screening tools that are available. You can also build a custom tool if that's your preference. And there's the opportunity to use the tool that you're currently using in your EMR and creating a bidirectional interface with the referral system. And creating that interface will come at no cost to you. So we will not be charging for any services for interfacing with the system or creating custom tools in the system. And from there, you'll have referrals that are tailored to individual needs. So you can identify all the unique needs of an individual, either through screening or just through identifying certain health conditions. And then you'll see a referral that'll show not only what's most geographically convenient for that person, but ensures that they meet eligibility criteria, that the service provider meets other unique needs such as language services or just other preferences that may make them eligible for one service, whereas they're not eligible for another. And this can really help prevent situations where someone is referred for something and they end up not being eligible for that service for whatever reason. There'll also be alerts and communications on the platform. And this is a really great feature because right now, currently, if you're doing referrals and you're looking for that referral feedback, you're playing phone tag, sending emails, and this really sets it up so you can do everything on one platform, all in one place. So if you're sending a referral or you're receiving referrals, you'll be able to communicate with the organizations on this platform at your convenience. And you can also send alerts and communications to the clients to ensure that they are aware of when their appointments are and to decrease instances of no-shows. There will be dashboards, analytics, and outcomes to produce individual provider and organization level service reports and dashboards. And this gets back to that sort of data-driven approach. And when we are capturing all this data, we can start to see what types of services are being referred to more often, how much time it takes for those services to be, how much time it takes to respond to referrals for those services, how much distance people are traveling for those services, and a lot of other metrics based on the referral detail in the system. So one of the biggest benefits of using a system that captures all this referral data and SDOH coding is that organizations will be able to aggregate and analyze that data and use it for quality improvement, gap analysis, and business intelligence, all of which will make us a much more informed community and more informed community that can just better serve those in need. And we also have that a raw data package. So if you already have your own business analytics system, we can pull down a raw data package and provide that to you at a frequency of your convenience, and you can load that into your system in order to do data analytics on that. And the last feature here to highlight is the client portal. So clients can access a separate application to search for services that meet their needs and are convenient for them, and they can self-refer and access the services on their own. So this platform will be separate from the referral system that clients would use to just search and navigate, and we'll be working to connect this platform to the referral platform so that down the road, we'll be able to see when clients are making self-referrals, you'll be able to see some of the activity that a person is engaging in. So if they show up for an appointment, you'll know if they've already addressed certain needs. Just going to cover two different use cases as a service requester and a service provider. So going through some of those features I talked about and how they would look as a service requester. So first, if you're a service requester, you can onboard your preferred network or universe of healthcare providers and community service providers, and then grow this network based on the different services that are in the system, or even looking at what types of partners you're gaining through using the system and add those to your network. When a client hits your door, you can find the unique profile in the system or sign them up. For service providers, they can use their own or built-in screening tool. When making referrals, you can check to see a person's referral history to see if that person has already been screened and referred for services in order to reduce redundancies. Not only can a service requester set up their trusted universe to make referrals, they can also search for services outside of that when needed. And lastly, service requesters can set up their organization preferences for receiving notifications, set up client reminders, and they'll receive a notification that a referral was accepted or declined. And when you have that referral feedback, that's the best type of referral in the system because you're closing that loop. And so you're getting all those additional data points in that type of referral relationship. For a service provider, the service providers can set up their organization's landing page to request specific documents or provide eligibility information. This can be set up to send information within the system or just provide a list of items that will be needed for the referral. This will reduce instances where people show up looking for help, but the service provider can't proceed because they don't have proper or required information. So this really just helps make sure that when people show up, that they have everything that's needed and we're able to help them. Providers can review screenings, referrals, and service history before the client even arrives to really enhance that experience for the client to avoid having to answer the same questions over again. Providers can ensure that people are not referred to services that they're not eligible for by posting that eligibility criteria. Providers can use communications within the system to send back requests for incomplete referral packets or request additional information to ensure that a client's unique needs are met, such as the need for translation services or transportation to attend the appointment. Client alerts will go out to help decrease those no-shows and missed appointments. And then lastly, in those closed-loop relationships, providers can close the loop by providing referral feedback on whether they've accepted the referral, whether they scheduled an appointment, if the person showed up, and if the service was provided. And you can identify what types of data you want to provide back to that provider who is sending the closed-loop referral. And we want to ensure everyone that the referral system does comply with HIPAA. There will be no additional layers of consent in order to use the referral system. So you won't have to have your members sign a whole new consent form every time you want to use the system or in order to send referrals for them. An organization sharing PHI through the platform, you would just follow your current referral process for consents that you have currently. So If you're collecting an ROI or you're just getting a consent to treat and you're making referrals based on care coordination through email, phone, or fax, you would follow that same process, except instead of using a phone or email or fax, you would use the system as the means for sending that information in those communications. So you do not need to add anything additional to your workflow. Our program timeline. So we're still in the implementation planning stage. We'll be starting a early adopter pilot over the summer from June through September. And this is really just a small group of organizations that we're testing certain use cases for. And the general rollout will begin in fall of 2021. And if you're interested in just getting information about the referral service, this is separate from what Christy is going to talk about in terms of the DAP program. This is just for the referral system if you want to stay updated on new events and as the program progresses. You can go to healthcurrent.org/SDOH and complete an interest form, and that just lets us know to keep you in the loop and to reach out as the program progresses. And from there, I'm going to hand it back to Christy. Thank you very much for being here today.
Thank you, Andrew. All right, let's dive in a little bit more into the differential adjusted payment program for SDOH. So on April 5th, Access did announce this new special track of differential adjusted payment program that would pay providers a 1% increase on their fee-for-service claims if they submit an SDOH registration form and a registration spreadsheet by May 14th of 2021. Reminder, that is this week. So this is your last chance to hear about the program, answer questions, and send in those forms. This is the list of eligible provider types for the program. I went through this a little bit earlier, so I'm not going to go through it again. But these are the organizations and individual practitioners, independent practitioners, that can register for this SDOH special DAP program. Next slide, please. How do you apply? On the Health Current website, and the link is right here. You will see 2 documents that need to be downloaded. One is the registration form, which can be used by an organizational provider type, like a behavioral health outpatient clinic, as well as an independent practitioner, like a licensed independent substance abuse counselor. So 1 registration form, 2 spreadsheets. 1 spreadsheet is for those organizational facility provider types. The second one is for independent practitioners, individuals who bill under their own Access ID. Next slide, please. We'll talk a little bit about the milestones. I'm sorry, once you complete the forms, be sure to send them back to Health Current, because that's how we're going to know that you registered for the program. Let's talk a little bit about the milestones, or the program requirements, for organizational and facility provider types. And I've listed them there. Milestone number 1, no later than May 14th, 2021, submit the registration form and the spreadsheet using the materials that you can download from our website and send it back into Health Current. Next slide, please. Milestone number 2, no later than February 1st of 2022, for clinics that already have an active participation agreement with the HIE, meaning you are currently participating in Health Current, accessing, sending, receiving data. You would submit a signed social determinants of health addendum to your participation agreement in order to continue involvement with this DAP program. So that's by February 1st of 2022. For clinics that are not currently actively participating with Health Current, you do not have a current participation agreement, you will execute a participation agreement and a social determinants of health addendum to participate in the social determinants of health closed loop referral system by February 1st of 2022. Next slide, please. Milestone number 3, no later than April 1st of 2022. Clinics would work with Health Current to develop, approve, and authorize a formal scope of work in order to initiate your participation in the closed loop referral system. There are several different ways that you can access the closed loop referral system. This is the mechanism, the scope of work is the mechanism for advising Health Current about which of those methods you want to choose and the time frame for when we will be able to implement it. No later than September 30th of 2022, or as soon as reasonably practicable thereafter. We will say that it is looking like we will be running a wait list for this first year of this DAP program because there's very high demand. So some of the connections may actually occur after September 30th of 2022, but that's okay. So as soon as reasonably practicable afterwards, start using the SDOH closed loop referral platform. The definition of what we will say are the criteria that qualify as use of the SDOH closed loop referral platform will be determined by October 1st of 2021. And Health Current will do that in collaboration with the community and with Access. So the providers that are participating and Access will have a say in what use actually means. Next slide, please. This is an example of the organizational closed loop referral spreadsheet. You can see it's pretty standard information. You'd list all the clinic sites that you want to have eligible for or participating in the program, the provider type associated with those clinics, street address, city zip, and most importantly, the access provider ID that's associated with each of those billing sites. All by May 14, 2021. Next slide, please. Milestones for independent practitioner provider types. And these are your physicians, MDDOs, physician assistants, registered nurse practitioners, and the LISAC group, all of which are eligible for this particular DAP program. Milestone number 1, no later than May 14 of 2021. Send in that registration form and the spreadsheet listing all the independent practitioners who will be eligible to participate in the program. Next slide, please. Milestone number 2, no later than February 1st of 2022. For providers that already have an active participation agreement with Health Current, so you're currently today accessing data, receiving data, sending data with the HIE, simply submit a signed SDOH addendum to your current participation agreement, and that'll get you in the hopper to participate in the SDOH closed loop referral platform. For providers that are not currently participating in the HIE, you'll need to execute a participation agreement and that SDOH addendum in order to participate in this particular program. Next slide, please. Milestone number 3, no later than April 1st of 2022. Independent providers must approve and authorize that formal scope of work where they select their preferred means of connecting with the social determinants of health platform. And then milestone number 4, no later than September 30th of 2022, actually start to use the social determinants of health closed loop referral platform. Again, for the purposes of this DAP, we will initiate a community process that's inclusive of Access and organizations and providers that are participating in this DAP program to define what use of the SDOH platform means. Next slide, please. This should be an example of the closed loop referral spreadsheet for independent practitioners. On this spreadsheet, you would list the names and provider types of each qualifying clinician and medical practitioner, also their access provider ID, and then if they're affiliated with an organization like a primary care practice, group practice, just please list the affiliated organization just so that we know who you're associated with. Next slide, please. So for current HIE participants, what do we do next? Submit the registration form and the spreadsheet by May 14, 2021. That's probably the most important thing to do this week. Submit a participation addendum for the SDOH closed loop referral system by February 1 of 2022. When we send this out or you download this deck off our website, all those links will be live, so you can go directly to the registration forms and the spreadsheets, download them from our website. Next slide, please. New HIE participants, what do you need to do next? Submit a registration form and an Excel spreadsheet by May 14th, this week. And then submit an HIE participation agreement and a participation addendum for the SDOH closed loop referral system by February 1st of 2022. And again, the links there at the bottom to get you to the documents that you need. Next slide, please. And this is just for interest, and you can also, this is a live link in the deck so that you can review this article at your leisure. This came out in early March of 2021 and really provided a great overview of the partners that Andrew spoke to earlier who were involved in the rollout of our statewide system and all the excitement that it's generating in the community. Next slide, please. So some key contacts. In order to get connected with the HIE, so new participants, organizations and practitioners who are not currently participating in the HIE, you want to reach out to Jamie Pena. Jamie is our manager of recruitment and engagement. Her email address is right here. If you want more information about social determinants of health and how that closed loop referral system will operate, you just met Andrew. Andrew is our director of social determinants of health, and his contact information is here. For more information about the differential adjusted payment program, please feel free to reach out to me, and my email address is here. Next slide, please. I think we're going to take some questions and answers.
Thank you, Christy. We do have one question in the chat, and I think this one is for you, Christy. We are a multi-specialty clinic. Are we eligible?
So the practitioners in your multi-specialty clinic likely are. I'm not aware that a multi-specialty clinic is separately licensed, and it is not one of the eligible organization types. So the individual practitioners themselves, you would fill out that individual independent practitioner spreadsheet with all their names, their access IDs, and the name of the clinic that they're affiliated with, and send that off to us with the registration form.
Thank you. We have one here. This is for Andrew. Using multiple platforms for member documentation and processes can be cumbersome. Are there plans for the EMR integration, or will this be a separate platform?
Great question. So yes, this can be integrated with your EMR. So it can be done in multiple ways. You can do a single sign-on, which would then, like if you're doing a workflow and at the end of screening or assessment, you can then click into the platform, identify the needs, and do that all in your EMR through a single sign-on click. Or it could be a bi-directional interface, which, as I noted earlier in the presentation, will be completely free, so there's no cost to that interface. And that would be setting up a more complex process of, doing everything in your system and then sending that data back and forth. That will take a little longer to build for each organization, but that is an option for everyone who wants to use the platform.
Thank you, Andrew. And here's a follow-up to that. How would the referral process look like for a member that has SDOH of homelessness?
Clay, can you read that one more time? It cut out a little bit on my end.
Okay. It's a follow-up question. How would the referral process look like for a member that has an SDOH of homelessness?
So the referral system can be utilized by any organization. So if you're supporting individuals that are homeless, you can refer them to services. We are working with the Maricopa County Associated Governments Continuum of Care group, as well as we are working with 211 Arizona to try to build an interface with HMIS system. So, and homelessness is one of the key areas of the SDOH services that we want to address. So we're looking at, in our early pilot, we're really looking at trying to connect resources for individuals, connect resources for unhoused individuals on the platform as part of that pilot. So we are planning on addressing that. That will be one of the key areas of focus on the system.
Thank you, Andrew. And here's another follow-up on integration. Will this require us to work with our EMR provider to add customizations of sending more information through our current connection to Health Current?
So in order to build the bidirectional interface where you're entering the information in your EMR and that's automatically going into the referral system and vice versa, we will need to work with your vendor to ensure to build those connections to the system. So depending on your vendor, that process will look different for every organization. But as far as from the Health Current and NowPow side of things, there will be no charge, and we'll support integrations with any system.
Thank you, Andrew. And Christy, that's all the questions we have at this time.
Okay, I recommend we wait just a couple more minutes. In case someone would like to enter a question in the chat. I'm wondering, Andrew, since there were questions about integration, did you review the different ways that providers can connect with the closed loop referral system?
Yes. Yeah. So
yeah,
you could. So it is a cloud-based system, so you can access it on any type of device, phone, computer, tablet, and then if you want to have a single sign-on, that would be a single click in your EMR, and then the bidirectional interface would be the more complex one that we would have to build with your EMR vendor, and that would match the workflow that works best for you, which can be just bringing the screening data over, or depending on how your system is set up, it could be as complex as doing the referrals within the system. I know with Epic, they have a platform that connects directly to NowPow to track all of that referral data as well. So depending on the system, there's different degrees of connectivity.
And when you develop with us in collaboration with Health Current, your formal scope of work next spring, those are the kinds of decisions that you'll be making at that point in time, how you best want to utilize it and connect with it.
We do have another question in the chat. Will this require more admin staff time? Is this at a time, a site? I don't really understand that. Is this at this time a site to check for referrals?
So the system is really meant to be a resource for you. So additional admin time is probably not likely. And maybe if you're using administrative staff for running reports, but the way that I view the system is it's replacing the process that you're currently using and changing the way we're communicating for referrals. So if you're already making referrals and you're sending those via phone, email, fax, and you have a system for following up on those, or maybe you're just providing the referrals to members and having them go and then them providing the feedback, this system would just fit into the workflow. So you would use this system as a means for sending the referrals, communicating to the members, and communicating to the referral providers. So you're using you're doing all the things you're currently doing for your referral services and feedback, but you're doing it all on one system, all in one place, and it'll be more convenient because if you're getting that, if you're a referral provider and you're needing to connect with where you're referring someone, it may be difficult to connect with them, or they may not be available at that time, but now you can send a message on the system directly connected to that referral, and then they can provide that feedback at their convenience. So it just creates more pathways for communication and more clarity across different data points.
Thank you, Andrew. And just to confirm, the links to the forms and PowerPoint presentation is available online or will be emailed to us. Yes, the registration forms are available now out on the Health Current website, and the slide deck and this links to this presentation will be emailed to everyone attending today. Oh, there you go, right there. And that's all the questions again.
Okay, I would also recommend that folks check out the frequently asked questions document that's on that landing page for SDOH DAP program on the Health Current website. And I see that the email is going out. Is that linked to our page?
Yes, it does, Christy.
Thank you. Other questions? Any other questions out there? We'd certainly love to see a lot of independent practitioners who want to use this tool registering for this program so that you can not only use the tool, but also get paid for it, which is nice. This will be a huge benefit to treatment planning and really taking care of members and patients. I should also say this is one of the first times Access has actually released a differential adjusted payment program exclusively for independent practitioners. We may see some of those in future years, but this is certainly the first time that I'm aware of for as long as the DAP program that MDs, DOs, physician assistants, and NPs could register under their own Access ID. I think there's a question for Andrew.
Yes. Could this system be used to track DME prescriptions for patients, or is this for provider-to-provider referrals?
The DME prescriptions?
Durable medical equipment orders.
Okay. So this system is really meant for making referrals for services. So if you're making a referral to an organization that provides that equipment for a member, it would be used in that way, but it's not meant for prescriptions or for ordering medications or equipment. That it's not set up for that type of system, that type of information. But certainly, if that's something that we could look at or explore as a possibility, I don't know if NowPow has ever considered anything like that, but that would be something we would have to do as a custom or new build.
Let me just speak real quickly to a couple common questions we've had in some of the other webinars that we've hosted on this. Hospitals that have already submitted a letter of intent to be in the regular 2022 DAP program, so not related to this special enrollment for social determinants of health. Those organizations already have a DAP requirement for 2022 related to getting connected to the social determinants of health closed loop referral system. So it's not necessary for hospitals to enroll in this particular special DAP because you're already included. Often folks want to know what is the DAP incentive paid on. So what qualifies for the 1% bump in the fee-for-service claim. So the DAP incentive is paid on Medicaid claims submitted for Medicaid beneficiaries. So Andrew spoke a couple times about the system itself being available for a broad swath of Arizona residents. This differential adjusted payment program is from Medicaid claims by registered Medicaid providers. If that stirs any additional questions. We'll wait just a moment. Okay, Christine, I think that's probably a wrap.
Thank you so much, Christy and Andrew, for this great presentation today. Again, the copy of the presentation will be sent out to all of our participants, and this session has been recorded and will be posted up on the DAP for SDOH landing page. The link is right in our chat. Just a reminder, as Christy said, this Friday is the deadline to submit your letter and your spreadsheet. So if you have any questions, please don't hesitate to reach out to Christy, Andrew, or Jamie Pena, our Director of Recruitment and Engagement. Thank you again, everybody, for taking your time today to join us, and we look forward to hearing from you soon. Have a wonderful day.